Hi, everybody. My name's Madeleine Gorman-Asal. I'm a recent graduate of UNB. I graduated with a Bachelor of Science in Biology, Mathematics, and Statistics. I did my honors thesis in math, and now I work as a research assistant at NB-IRDT. So today I'm here to talk to you about some of the health-based student research that is going on at NB-IRDT, primarily through the Pathways to Professions program, and more specifically, the VitalSignsNB stream, which is the health-focused research stream within Pathways. So, oh, just one second. There we go. So I'll start by introducing NB-IRDT and what we do there. Then I'll move towards the Pathways to Professions program, some of the research that happened this summer through that, and my personal experience with the program. And then I'll move towards the Vital Signs NB project this past summer. So I'll go over some of the key findings from that. So first, NB-IRDT stands for New Brunswick Institute for Research, Data, and Training. So we are a research data center positioned within the university. We're actually in Kierstead Hall. And the primary thing that we do is everything we do is largely centered around data. So we host data sets that are safe, secure, linkable, and accessible, as you can see in the green. We are actually the sole administrative data repository for the province of New Brunswick. So what that means is that we house data sets that were not necessarily collected for research purposes. They're things like education records or health records, but then by removing any personal identifiers and instead using this linkable ID, we can kind of cross-reference these different data sets and do research with it. So as you see in the red, we guide, partner, and conduct research. So we do our own internal projects, but we can also partner with external parties like government or even industry who come to us wanting to use our data or come to us with a data set asking us to do analysis, things like that. And we also have a policy evaluation and knowledge transfer arm, but today I'm going to spend a bit of time on our training initiative. So the Pathways to Professions program is within the training arm of NB-IRDT. So, Pathways to Professions, or P2P, is a 13-week experiential research program for UNB students, and it's open to anyone from any faculty. And the idea of an experiential research program being that we employ undergraduate students to work on research projects while offering a series of workplace readiness workshops, work-relevant tutorials, and networking opportunities. And the goal of this program is to truly prepare post-secondary students to transition to the workforce while connecting them with meaningful work that makes an impact on the New Brunswick community and helps them also build soft skills in addition to research-specific training. So in its inaugural year, there was 6 students participating and 2 project streams. So the first of which being PopNB or Population NB, who characterized health and economic population demographics for New Brunswick using open source data found on Statistics Canada. And the principal investigator for that project is actually Dr. Ted McDonald, and he's the director of NB-IRDT. And there was also Boost NB, who built a dashboard of economic indicators for New Brunswick to assess whether the province is progressing or maybe not progressing towards a number of economic goals. So the principal investigator on that project is Dr. Herb Emery, and he's the director of the Atlantic Institute for Policy Research. But the first year was such a success that we were actually able to expand massively in the second year. So we now have 20 students participating the past summer, and we were able to add 3 additional research streams. So PopNB and Boost NB stayed with a little twist on their project, and then the Experience NB team was added. So they evaluated experiential learning opportunities offered at UNB. And the principal investigator on that project was Dr. Sarah King, who's the director of experiential learning at UNB. Then there was Connect NB, who began a framework for the Data Connect networking program. So that operates with the goal of connecting undergraduate students with government stakeholders who want to conduct research with administrative data at NB-IRDT. And then lastly, we have Vital Signs NB, who again is the health-focused research stream within the program. This year, they examined outcomes related to the expansion of publicly funded vaccines available at pharmacies in New Brunswick, and the principal investigator on that project was Dr. Chris Folkens. So I was actually a member of the 2020 P2P program, and I found out about the program at a ASRJ conference in 2020. So I went to Reaching Higher because I was kind of feeling like I wanted some research experience, but wasn't totally sure how to get my foot in the door or what kind of opportunities were out there. And I ended up going to a workshop on big data that NB-IRDT was putting on, and they talked about the program, and it seemed like honestly a great fit with my degree. I liked that you would be able to work on your analytical skills, but also while building your professional soft skills. And I also thought it was really telling that they didn't require any degree to enroll in the program, but rather recognize the value of transferable skills, which I thought was a really good sign. So I applied and I was successful. So I worked as a data analyst on the PopNB project, again, working with open source data, characterizing various population demographics for New Brunswick. And I ended up learning so much, not just through the research experience, which was incredibly valuable, but also through a number of tutorials. So there was things like learning new analysis techniques, but there was also leadership workshops, and I got to learn about, basic economic measures, which I had never learned about in my Bachelor of Science. And then there was also plenty of networking opportunities. So we'd have these career connect sessions every week where we talk with someone who's making a difference in the New Brunswick community, whether that be within government or within industry or yeah, the university too. And then I ended up enjoying my time so much that I felt like my skills and my interests really lined up with NBIRDT, so I wanted to stay. I was lucky enough to transition to a research assistant position and working there part-time through the my last year of school as I was wrapping up my undergrad. And I got to work on a couple health-based projects with Dr. Sandra McGalley. So there was planning for community resiliency and recovery from COVID-19. And then we also assessed the mental health impacts of COVID-19 based on some survey results. Um, and yeah, I really enjoyed my time there. And then as soon as I graduated, I shifted into a project mentor role on the PopNB project, and then also the additional VitalSignsNB project this summer. So it was really cool being able to contribute to the program and coming back to it in a different way. And I honestly feel like I learned just as much as I did last summer, but just kind of in a new way. And I got to work on a whole new set of skills. So I definitely can't speak highly enough about the program. I would definitely recommend applying for anybody who's interested. The applications are opening late November or around there, and they're going to be due early March. But if you want to just read more about the program, I've just kind of gone over very briefly the stream. So if you'd like to read more, we have a 2021 program and review that's posted on our DataNB blog. You can find it on the website. And if you have any more specific questions, you can also email our training team, and I can post both those links in the chat afterwards if that's helpful. Or I don't know if I can do that, but I'll try to see if we can get that to you guys. Um, so now I'll shift towards the more specifically Vital Signs NB's work this summer. And the title of the project was Projected Outcomes of an Expanded Role for Pharmacy Professionals in the Provision of Publicly Funded Immunization Services in New Brunswick. So I'm currently kind of working on wrapping this up with the team, finishing up a manuscript right now for publication. But if you're interested in a comprehensive summary of our methodology and results and project introduction and everything, the full report is available on our website already, so you can definitely take a look at that. But today I'll just introduce our team. We had 3 undergraduate students, so all pursuing a Bachelor of Science, but then we also had a master's student who was our communications coordinator. And this was, again, at the leadership of Dr. Chris Folkens, who's also a registered pharmacist. So first, I'll just introduce the scope of pharmacy practice in New Brunswick. So currently, pharmacy professionals, so that includes pharmacists, but also pharmacy technicians, can prescribe and administer many vaccinations. So they're all available at the pharmacy, but there's only a couple, the flu and COVID vaccines, that are publicly funded. And what I mean by publicly funded is you can go to the pharmacy and as a patient not have to pay anything and receive the vaccination for free. The government is going to be the one covering the drug cost and the service fee, so paying the pharmacist to administer it and the purchasing of this drug. All those other vaccinations that are still available at pharmacies outside of the flu and COVID vaccines would require the patient to pay out of pocket or through private insurance in some cases, but for the drug cost and the service fee themselves if they want to go get that vaccine at a pharmacy. However, many of these vaccines that you'd have to pay out of pocket for at a pharmacy are available at a physician's office for free. So the government pays for that vaccine when it's administered in a physician's office, but not in a pharmacy setting. So this can kind of represent um, a, a barrier to immunization services. So if someone doesn't have a family physician, they'd be forced to either go without their vaccination or have to pay out of pocket for it. And it also kind of has a financial incentive of putting more people in physician offices for a service that's readily available at a pharmacy. And given that some people still choose to pay out of pocket just because of the great accessibility and convenience of accessing these immunization services at a pharmacy, considering their greater hours and things like that. So, our goal was to understand how expanding the number of publicly funded vaccines that pharmacy professionals could administer would impact healthcare costs, access to care, productivity, and health outcomes for New Brunswick. So, we modeled and compared two potential immunizer scenarios with a focus on adding two potential new vaccines to this publicly funded repertoire that's available at pharmacies. And we projected outcomes of interest that were informed by trends observed when pharmacists were introduced as publicly funded flu vaccine providers. So, by looking at the vaccination rate, what happened to the vaccination rate, and what happened to like how people distributed themselves between a pharmacy and a physician's office when they could go to either at no personal cost for the flu shot, what percentage of people went where. So, as I mentioned, we observed those past immunization trends, and that was using administrative data at NB-IRDT. And then our model examined the addition of two potential new vaccines, the pneumonia vaccine and tetanus boosters. And these were selected because they have a wide eligibility criteria. So a lot of people are eligible to receive these and access these yearly. And they're also very easy to assess the eligibility in just a community pharmacy setting. So it doesn't really require like a physician. It's not a difficult diagnosis anyway. So, and then we also compared the costs and outcomes between a physician only versus a blended model. So by physician only, that means just if the current situation remains in New Brunswick, where if you want a pneumonia vaccine or a tetanus booster, you can get it for free at a physician's office. But if you want it at the pharmacy, you have to pay out of pocket. And then we compare that to a blended model. So that's as if now you could access pneumonia and tetanus vaccines at a pharmacy at no personal cost as a patient, but now the government is paying for those vaccines. So, based on what we see, what happens with the flu vaccine when it became publicly funded, we see that the majority of people choose to access their publicly funded vaccine at a pharmacy instead of a physician's office. So, 61.1% of people by 2023 are expected to access the flu vaccine in pharmacies in New Brunswick rather than the physician's office. And we assume the same percentage for any other publicly funded vaccine. So, we assume the same for pneumonia and tetanus boosters. And what's also reported in the literature of what happened when the flu vaccine became available at pharmacy is we see there's an increase in vaccination rate of 12.3%. So when we apply this 12.3% to pneumonia and tetanus vaccinations that are expected, if the current situation remains, then that would mean an additional over 2,500 vaccinations under the new blended model. And considering the great number of additional vaccinations that would be required to be purchased and by the government now, that would require an additional initial cost of just under $70,000 for the government to pay for all these additional vaccinations. However, there are a number of positive economic, social, and health outcomes that are associated with increased vaccination rates, so more people protected against illness, and also the freeing up of physicians' time. So now I'm going to look at how the associated outcomes of these clinical outcomes. So for firstly, physician time savings. So now when 61% of people are getting their vaccinations at a pharmacy, that's a switch over from 100% of people going to the physician for that. So that's just under 12,000 vaccination appointments that are no longer happening in physician offices. And by knowing that the administration of a vaccine is just under around 10 minutes, this means over 2,000 hours of physician time saved annually. So that's not even accounting for the administrative tasks associated with the vaccine, that's purely administering it. And given that we can kind of guess how, on average, how much time a rostered patient takes up of physician time, which is just around 40 minutes per year, we can translate that time into just over 3,000 additional new patients rostered in New Brunswick with a family physician. That's also, though, assuming that 100% of this time savings is going to be allotted to orphan patients and not other primary care services. And The literature also tells us that orphan patients are much more costly to the healthcare system than a rostered patient is. This is because they don't have as much access to preventative care services, but they also have to access their primary care in high cost acute care centers like an ER. And this is expected to save the province over $1.4 million annually with this additional rostering of new patients, because each orphan patient is estimated to cost the healthcare system just under $500. So that's a massive annual savings expected. And we also estimated the pneumonia hospitalizations avoided. So this was just among the 65 plus age group, because they are more at risk of serious illness and hospitalization if they contract pneumonia. So given the increased vaccination rate, there'd be an additional 790 vaccinations estimated among that 65 plus age group. And this would, when we account for the base risk of illness and the effectiveness of the vaccine, this translates to about 1.2 pneumonia hospitalizations avoided annually. And while this seems like a small number, pneumonia hospitalizations are very costly to the healthcare system. So it's about $10,000 per hospitalization. So that actually translates to over $12,000 in savings expected annually due to this avoided hospitalization. And then lastly, we looked at workplace productivity savings. So the first being due to avoided vaccination appointment time. And what I mean by that is, now that 61.1% of people are expected to get their pneumonia or tetanus vaccine in a pharmacy rather than a physician's office, we expect that they won't have to take time off work to get that vaccination because of the greater accessibility of pharmacy hours compared to a physician's hours, who are much more limited and typically only happen within a typical working day. So this is an estimated just under 12,000 vaccinations in the workforce that are expected to contribute to these avoided time losses. So just under 12,000 people who are now going to the pharmacy and don't need to take time off work, who were originally taking time off work to access their vaccine. We looked at the amount of illness cases avoided as well, but this was negligible considering the relatively low risk of illness among this age group, this working age group. And then, so the total amount of productivity hours that are saved associated with these vaccination appointments that no longer are during a working day is just under 12,000 hours saved annually. So, and if we apply a average hourly wage to this found on Statistics Canada, we can estimate that this would save the province over $280,000 in productivity savings annually under the blended model. So just to summarize some of the cost breakdown, so we do see an additional upfront cost of just under $70,000 associated with purchasing more vaccines and paying pharmacists to administer all these additional vaccines. But there are so many indirect positive health outcomes that are associated with a number of cost savings to both the healthcare system and also productivity savings that it clearly vastly outweighs the additional upfront costs. So we expect just around $1.8 million of savings, and that's also annually expected. So again, this vast amount of savings too is just from a simple policy change. The administration of these vaccines is already within pharmacists and pharmacy technicians' scope of practice, so there wouldn't require any additional training. It would just be a policy change of adding just in our example, 2 of these vaccines to pharmacy's scope of practice. So I'd like to acknowledge and thank NBIF, the New Brunswick Innovation Foundation, whose generous funding made this support possible. And I'd also like to thank the ASRJ for allowing me to speak about the work this summer. And I'd also like to thank everybody listed on the screen who made this project possible through giving us letters for support for funding, or also helping out complete this project behind the scenes and giving us valuable feedback and advice. And then in particular, I'd like to thank Dr. Chris Folkens, who is the principal investigator on the project, and also Eva Christensen, who's the P2P program administrator. So I'll just do one last plug for P2P. VitalSignsNB is returning next year. So we'll be coming back with a slightly different project, but still healthcare focused. If you found our work here interesting, that I went over today. So you can definitely apply. If you want to subscribe to our DataNB newsletter, they'll be sending out the applications when they're available. And you can also follow our Instagram. We have one where we post some of the updates about the research that's coming out of NB-IRDT. So thank you so much again for listening to me talk about the work from Vital Signs NB this summer, and I can take any questions now if anybody has any.